column 1 if you want to, with hard work and if you do what you're supposed to do. And I promised her, I said, look, I am going to be the best patient that you can imagine. I have too many people that are depending on me.
Yes.
I need to get this fixed and I need to get it fixed now. So within, I'm going to say 6 weeks.
Oh, you were incredible.
I was able to drop 40 pounds.
Yes, you've lost weight. Your numbers have gone down.
I'm exercising twice a day. I am now
eating healthy.
I'm eating very healthy. I'm following the Metabolism Miracle as best I can. And I'm looking really forward to having this panel repeated. Now, we've done other blood work, in-house type things.
Yes.
To keep track of my cholesterol, sugar, and that sort of thing. And oh, by the way, I'm not on the blood pressure medicine anymore.
Awesome.
I was able to come off of it after about 2 months.
Yes.
So I went from stroke and heart attack level by doing the right things, by seeing a doctor who cares about me and who wants me to get better and gave me the path. I've got a blood pressure level now that is very normal.
It's great.
It's where I always thought it was, but it wasn't. It was way out of line. And I just can't tell you what it's meant to me. I've always been doctor adverse, really, and that never thought I needed to have any guidance or help, discussions with anybody. But I can tell you now that having learned what I've learned, that one of the most important things we can all do is develop a good relationship with our doctor. Find one who cares about you. Find one who loves you, who is going to take care of you like you were a family member. And go see them and get everything checked out, because you might be like me. You might be so totally surprised. It was amazing to me. Now, I've got a ways to go yet, because I need to get this panel repeated.
But wait a minute. You are an inspiration. You are an inspiration to your family, to your friends, to your co-workers. And you know that when they say the word, he's a poster child for this, I actually presented his numbers and his case at the Cleveland Heart Lab conference when I was in Las Vegas.
I remember
the
that.
pictures are on my website. So he really is a poster boy. Randy, you have done it. You are moving in the right direction, and I love to hear you say that we with information, with knowledge, with given goals that are attainable. You did it, and you are doing it every day. It's incredible. It's wonderful.
Well, it's a lifestyle change, and
Yes.
you have to be willing to make the changes. And, I was just kind of rolling along happy and having good success in my life, have a wonderful family, wonderful wife. Everything in my life was just going along just wonderful until I went to the dentist. And then I found out my life is going to have to change here, and it has in a very, very positive fashion. And you're right, there are a lot of people out there that I can and hopefully do influence. And I want to be healthy not just for me, but for my family and my kids and for all the other people around the community that I try to impact in a positive way. And, the longer I'm here to help, the better I'll feel about it, that's for sure. But I think it's important that we all give back to our community in as best we can. And I want to stay healthy just to be here in this Charlotte County and Punta Gorda, Port Charlotte area, and just really work hard for this whole community and the people that are in it. It's what I do.
That's wonderful.
It pleasures me to be able to do that. Now, if I were to have continued on the path that I was on, unknowing that I had these issues, I could have had a stroke or a heart attack at any time. That's behind me now. I have made the changes that I need to make, and the continued guidance from you, Dr. Triana. I really feel very happy and very confident about, I'm going to be here. I'm going to live to be 100, maybe 105.
Well, that's what I tell my patients. I want to be here till I'm 100. I love to take care of my patients. I feel the same commitment you do to the community. I'm always studying, learning. At the Triana Prevention Center, we have, you've been there. You know how my ladies are. They're wonderful.
They definitely are wonderful, and I've learned a little bit about lipids as well.
A lot about it.
And I've learned about the infectious nature of you know, our arteries, our veins. I didn't realize that how our lifestyle and how we eat and how we exercise, it all boils down to really that the function of your heart and your circulatory system. And I didn't even know what a lipid was until I found you, and now I know quite a bit more. And I know that my lipid numbers were not good at all either.
Oh, they're so much better now.
I have improved dramatically in that area as well. So I'm going to continue doing what I'm doing. I still want to get in even better physical shape. I still have some goals to attain, but the most important thing is I'm off the medicine. I'm back to normal in terms of the numbers, and I don't have to worry now. I'm not worried about having a stroke or having a heart attack. I'm worried about now getting rid of the next 5 pounds and my blood pressure being another 5 notches lower. I'm worried about those kind of goals at this point, and so my focus is good.
But you have done it with diet, with exercise. You did take the medication. You are on a statin medication to help, because we know diet and exercise is a big player, but we also know that inflammation in your arteries, which we know statins decreases the inflammation. Also, we know it decreases those numbers. I mean, it's the whole picture. And that's why when I tell patients, you might need a medication, there's nothing wrong with getting the treatment that we need for the problem that we have. There's so many things we can do. There's medicines, there's diet, there's exercise, there is decreasing our stress levels. We've spoken about that here in the program. All these things you're doing.
Well, now that my blood pressure isn't twice the norm, I'm not nearly as stressed out as I was at that time. But yeah, the statins are very important to me because there's no reason not to take. Those are not like taking medicine for me. It's like taking an 81 milligram aspirin. It's the same thing. It's not something that's going to hurt me, and there's no reason I shouldn't take it. I think we should all take statins as we get older, and we'll all live longer, and we'll avoid our heart issues if we do take the statins. So I don't intend to ever go off the statins. Those are going to be around for a long time. But the other medicines that I had to take during this process, they bothered me a little bit, and so that gave me incentive also to continue down the path of getting off of that third column on that on my results, getting to the middle column and then all the way back to the left side on that Cleveland profile. And I'm going to have that Cleveland profile done again. How long now till I have that?
Well, we wanted to wait at least 6 months. We can actually do it in 3 months. But we've been doing tests, you know. We've done regular blood sugar test. We've checked your cholesterol, your triglycerides, your HDL, your LDL cholesterol, and all your numbers have improved. Your number of your blood sugar is improved dramatically. It's just so wonderful. And I'm sure you must feel so much better.
Well, I didn't know that I didn't know I wasn't feeling this good until I felt this good. Now,
That's interesting, isn't it?
Now I recognize the fact, wow, you know, I feel pretty darn good here. But before, I was just moving through life, accepting, you know, how I felt each day and working hard every single day of my life. I mean, I wasn't paying a whole lot of attention to how I was feeling. Today, I feel just really good. I feel great.
Well, you know, it's part of the denial is that our bodies actually learn to adapt to not feeling good, to even being anemic or having a low oxygen level, which are not your problems. But our body is incredible at adapting to the different stresses, both health and psychological, that we throw at it. So you now can say, wow, I feel so much better.
Well, at one time, my mind and my body weren't two different things. I just didn't pay any attention to how I was feeling or what my heart rate was, what my blood pressure was, what my sugar was. Now I've got two different systems going on. I've got my mind and my body, and sometimes they're in conflict. When my mind says, no, you don't want to go do 30 minutes on that tread climber, and your body says, yeah, you better go do 30 minutes on the tread climber and just get it over with and get it done with. And then as all of our lives adapt as we go through them, and as I have adapted to this pattern of exercise, then it's coming a lot easier and a lot more natural. Now, when I first started, I was so upset and I was so determined that the next night after I found out I have these problems, I started walking 4 miles. Okay?
Mm-hmm.
So I go into my good friend Dr. Katzen and partner, and I say, Dr. Katzen, man, you wouldn't believe it, I am walking 4 miles a night. He said, would you stop that? You're going to hurt yourself. Are you crazy? How about walking a mile? Just figure out where the mile mark is and just go half a mile down, half a mile back. And I said, oh, well, not only am I doing that, but I'm doing 30 minutes in the morning on this, and I'm doing 30 minutes a night on that. He said, would you just stop that? He said, you haven't been exercising like this for all of these years, and now you're so worried about getting better, you're going to hurt yourself. So back up, take it easy, change your lifestyle slowly, enculturate this type of exercise into your life process. Don't just slam it in there and expect that to be good for you either. Everything in moderation. So I got on a very liberal, what I thought was